and welcome to the 2023 Michigan Homelessness 101 webinar recording. I'm Lisa Chapman, Director of Public Policy for the Michigan Coalition Against Homelessness, or MICA as we are known. Each year, partners in the campaign to end homelessness come together to review the state of homelessness in Michigan, including data, funding, programs, and plans for housing and homeless response around the state. In 2023, we are fortunate enough to have with us leaders from the Campaign to End Homelessness, from Michigan Department of Health and Human Services, Michigan State Housing Development Authority, and Michigan Coalition Against Homelessness, who will inform us about efforts that the Campaign to End Homelessness is taking, as well as entities at the state level who are working on these issues and addressing homelessness in Michigan. So now let's turn our attention to our agenda for the day. We will cover in this session homelessness in Michigan, the 2021 annual report with Jerry Leslie from MICA, MDHHS programming with Paula Kaiser Van Dam, Michigan Interagency Council on Homelessness and the Campaign to End Homelessness by Kelly Rose, and Mr. Programming also with Kelly Rose. And then finally, what's next and how the Michigan legislature can lead with Eric Huffnagel. For the first segment, I'd like to introduce Jerry Leslie, who is the Homeless Management Information Systems Project Director at MICA, who will cover the 2021 annual data report. Jerry, to you.
Very good. Thank you, Lisa. And we're so glad to have everyone here for this Advocacy Day. And so again, I am the HMIS Project Director for the Michigan Coalition Against Homelessness for a Michigan statewide Homeless Management Information System, which is what the acronym MISHMIS or MSHMIS stands for. It's our primary database for tracking homeless persons who go throughout the system and receive services at the variety of homeless agencies that we have throughout the state. And if we could go to the next slide, Lisa. We're going to take a look at the 2021 homeless annual report that we publish every year in the state of Michigan. We're going to do a brief overview of some of the highlighted points of this report and talk about what are some of the unique things we saw within 2021 in regards to the homeless population that we have within our state. So first of all, when we looked at the 2021 statewide homeless numbers, we saw that 30,746 people connected with this shelter or street outreach worker at some time in 2021. So essentially, 30,746 persons were homeless, had connected with one of our shelter programs or with a street outreach worker to be verified as homeless at some point in 2021. So this was a 2% decrease from 2020, where we saw I want to say, I can't see the numbers, but there was a 2% decrease there. And we across the board saw a general decrease, especially in the southern portion of the state. Although in the northern 1/3 of the lower peninsula, there was an increase in our Prosperity Regions 2, which is the Greater Grand Traverse area, and Prosperity Region 3, which would be northeastern lower peninsula of the state of Michigan. And much of that was more so due to the fact that we had more resources on the ground and more workers who were able to engage with people that may have not been there in the first place within previous years. One thing to stress, though, is that in the overall number of things, those numbers make up a smaller percentage of the overall statewide population. So just be aware that those increases were not as numerically as significant as would they've happened in more of a major urban area across the state. And go ahead, Lisa, to the next slide. So one thing that we did in 2022, going back and looking at 2021 data, was we partnered with an organization called C4 Innovations, which is an organization that has a mission to advance equitable access to recovery, wellness, and housing stability for people who are systematically marginalized. And so we at the Campaign to End Homelessness in the state of Michigan were participating in an initiative to conduct a racial and ethnic equity system analysis across the entire state of Michigan. And we were able to, with our 2021 data, discover a number of things regarding racial and ethnic disparities that exist within the state of Michigan. First of all, one of the first things we took a look at was what was the composition and the makeup of various racial and ethnic groups within the general population across the state of Michigan, looking at census data. And then we broke that information down further, looking at within those racial and ethnic groups, what did the populations look like who lived below the poverty line? And then also, what did the populations look like who were counted within our 2021 PIT count, or our homeless count of persons who are homeless on one specific night of the year? What that work with C4 revealed to us is that although, for example, looking at our white population in the state of Michigan, they make up about 78.4% of our total statewide population, we saw a decrease in their representation in both those persons who were living below the poverty line and those persons who experienced homelessness. So 78.4% of Michigan's population are white. However, when it comes to those individuals who are living below the poverty line, that number dropped to, and I'm looking to read the number here real quick, but it looks like 62.3%. And then for those who were in the group that were part of the homeless population, it was only 43.2%. However, conversely, if you look at those who are Black or African American within the state of Michigan, they only make up 13.8% of our general demographic. However, they make up 27.3% of the persons we have in the state of Michigan who live below the poverty line, and they make up 49.6% of persons who were counted within the 2021 PIT count. And what that basically represents to us is that Black households are 3.6% or times more likely to be represented in the homeless count when compared to the broader census demographics. We also saw, even though the population is much smaller, but we saw that Native American and Alaskan households are 2 times more likely to be represented as being identified as being homeless when compared to the broader statewide census numbers. Go ahead to the next slide, Lisa. We also took a look at 2 other things that dealt with outcomes. The first thing was looking at the length of time that persons experienced homelessness. And the second thing was looking at disparities in people who returned to homelessness after exiting the system to a permanent housing destination. So while across the board, and of course during the pandemic, we saw that all of our population groups saw an increase in the length of time that they were experiencing homelessness, white households saw the smallest increase at 56%. Our Black or African American households in the state of Michigan were 78%. And as you see from this, Native Hawaiian and Pacific Islanders saw an increase of 163%. Although I do want to preface that saying that the sample size for the population of Native Hawaiian and other Pacific Islander persons was extremely small in the state of Michigan, small enough that a couple individuals, a couple households had the ability to impact the overall length of time in it. So statistically, this population was small enough to be a bit of a challenge when measuring it, just due to the small sample size we had to work with. Also looking at average return rate for persons who were experiencing homelessness out of the total population, that we saw, those who were returning to homelessness who are from white households were approximately 45% white households, whereas within black households, they were 44%. This does fall in line with the approximate number of households that were being composed of the overall homeless population. So it falls in line with the numbers from the general homeless population that we saw earlier that we referenced from one of the previous slides. Go ahead to the next slide, Lisa. And I do want to talk about some of the challenges that we have here in the state of Michigan. And one of the challenges, as many people will know, is that the cost of renting a property is oftentimes much higher than what the income that a household makes in order to be able to afford the housing. And to look at it, for example, within our state of Michigan, looking at census numbers, we find that approximately, I want to say 30% of our households who are white in the state of Michigan are renters, whereas that number goes up to 58% of Black households and 46% of Latino households based on U.S. Census Bureau statistics for the year of 2022. When taking a look at the National Low Income Housing Coalition's annual Out of Reach report, which documents the cost to rent housing within the states across the country, we find out something that is rather interesting about this. Now, first of all, in order to be able to afford a 1 and 2 bedroom rental at the calculated rate that's traditionally used of no more than 30% of your income being used for housing, we find that a household must have a hourly wage, working full-time, of course, this is 40 hours a week, of $15.18 to be able to afford a 1-bedroom rental. That goes up to $19.10 per hour if affording a 2-bedroom rental. Or if we want to look at it another way, if you are making the minimum wage here in the state of Michigan, which is $9.87, a household working at that rate would have to work 62 hours per week at that 30% to be able to afford a 1-bedroom rental. Or that household would have to work at 77 hours per week in order to be able to afford 2-bedroom rental. One thing we did see, of course, was a drop in evictions between 2019 and 2021, dropped by 44%. This was largely due to the eviction moratorium we had in place across the state throughout the COVID-19 pandemic. Of course, in current times, with those eviction moratoriums being lifted, evictions are now being processed. And so we've seen those numbers begin to go back up. But having that eviction moratorium in place was one of the keys in reducing the number of people who were becoming homeless throughout the state during the pandemic. Also, we do want to credit the fact that due to SARA funding that we had in the state of Michigan, we had over 67,500 households who were assisted by the SARA funding within the state. Lisa, if you want to move to the next slide. And then looking at outcomes for persons who are experiencing homelessness, we typically look at a couple key outcomes. One that we're looking at here are going to be the number of first-time homeless. We'll also look at length of time homeless, look at discharges to permanent housing destinations and returns to homelessness. In 2021, we saw a decrease. It went from 16,050 persons who were first-time homeless in 2020 down to 15,882 persons who were first-time homeless in 2021, a drop by approximately about 200 people within number of first-time homeless in the state. However, we did see an increase in the average length of time homeless, went up from 59 days, in 2020 to 69 days in 2021, an increase of 10 days. And this is, again, due to a number of factors, many of which would be pandemic related. And go ahead to the next slide, Lisa. And looking at measure 3, these will be the percentage of persons who are exiting to stable housing or retaining permanent housing. Those exiting street outreach, we saw a modest improvement in discharges to permanent housing of 1%. However, those exiting shelters, transitional and rapid rehousing projects, we saw a decrease across the state of a drop of 12% of those persons did not exit to a permanent housing destination. Whereas those who were in permanent housing, permanent supportive housing, who were exited to permanent destination stayed flat at 0%. Although those numbers typically across the state run in the high 90%, which is a very good discharge destination rate to continue holding on to. The number of persons who were having a new homeless episode within a 2-year window after exiting to some form of stable permanent housing across the board dropped, which was a positive thing. So we saw people who returned to homelessness drop by 3% within that 2-year window. Those in street outreach dropped by 7%. Those in permanent housing went down by 4%, and those in transitional housing went down by 2%, for an overall decrease in total returns to housing by negative 3% for those persons who were returning to homelessness after exiting to a permanent stable destination. And I'll turn it back over to you, Lisa.
Thanks, Jerry. That was fantastic information. Next up, we have our partner from the Michigan Department of Health and Human Services, Paula Kaiser Van Dam, who is the director of the Bureau of Community Services, who will talk about the state's MDHHS programs and involvement in the campaign to end homelessness. Take it away, Paula.
Thank you, Lisa. Appreciate it. If you want to go to the next slide for me, that would be great. So thanks everyone for participating in Advocacy Day. We really appreciate your willingness to go and educate our elected officials about the importance of homelessness and the need for resources and continued work related to ending homelessness. So just really want to thank you for that. Here at MDHHS, we have a Housing and Homeless Services unit, and that unit is led by Lynn Hinges, and within that, she has a tremendous team that I just want to acknowledge as I go through the programs that they support and administer. Just recognize them for the great work that they do each and every day. So thank you. Next slide, please. So here at MDHHS, we have a portfolio for the current fiscal year, for fiscal year 23, of about $57 million. The key programs that we administer include our emergency shelter program. So we are one of the largest funders of emergency shelter in the state. That is about $18 million a year. It serves both singles, adults, and families. The intervention is actually, obviously, we pay, for shelter and or moteling in communities where the shelter is not available. We also administer some HUD rapid rehousing programs. So that equates to about $4.6 million a year. So that is short-term rental assistance up to 24 months of leasing or rental assistance for singles, adults, and families, primarily in the balance of state or more rural parts of the state that program is administered in. And then we also have HUD permanent supportive housing, or PSH, as it's often referred to. We currently have a portfolio of $6 million, again, primarily serving the balance of state continuum. And those dollars are available for singles, adults, and families. And that intervention is long-term rental assistance as well as ongoing case management services. So we serve about 970 people a year, sometimes up to 1,000. So those are extraordinarily important resources that helps really some of our folks experiencing homelessness who have the most significant barriers. In addition to that, we also operate the Homeless Youth and Runaway Program, otherwise known as HYR. So the current fiscal year, it's 7.7 million. This program serves youth and young adults. Again, we served about a little over 1,000 people this past year, and it provides funding for emergency shelter and transitional housing for the youth. We also operate the HOPWA program, which is Housing Opportunities for Persons with AIDS. So that's about 2.7 million. It provides both short and long-term rental assistance for folks who, single adults with HIV and their families. And then the final program we have, which is our Projects for Assistance in Transition from Homelessness, which is PATH. I know there's lots of other PATH programs throughout the state, so that's why I said that's a very long name. But this is, in essence, the funding that we provide to communities for street outreach. So we provide those dollars to different organizations across the state to go out and connect with and try to engage with folks who are living in unsheltered situations, could be living in the street, living in cars, other places, and to engage them and try to get them to engage in services so that we can ultimately find housing for them, etc. Next slide. In addition to those programs I just mentioned, we currently are administering 2 other pots of money that we've received from the legislature. One is our shelter infrastructure repair grants. So in fiscal year 22, we were given $10 million to provide infrastructure grants so that shelters could embark on renovations or other types of repairs that may be needed. We are fortunate to provide 49 shelters across the state with dollars to begin to do that work. So we're super excited about that. Although I will say that there was 18 million in requests that came in for that pot of money. And we know that based on the applications that came in, the need is significantly there. And so, being able to have an ongoing pot of money like this would be extraordinarily helpful because we know the need is there and that shelters are doing the best that they can. But typically the funding that they get is used for staffing and other operations, and they don't have additional dollars to make the necessary repairs or improvements that they would like to make in those shelters. So that's exciting. We also, in the current fiscal year, received a $6 million pot of money to cover, to pilot some additional dollars for supportive services for permanent supportive housing. I mean, we recognize and know that often the supportive services part of permanent supportive housing is underfunded. And so really being able to provide some additional dollars to existing programs to beef up those supportive services is really exciting. We just issued or closed out an RFP. So applications were just due to us February 27th. So we will be reviewing those and making funding decisions and providing notification on those by April 1st. But we're really excited to be able to help improve the overall quality of supportive services by being able to offer these additional supportive services to programs across the state. Next slide. In addition to the programs that we administer, we also are very focused on addressing the social determinants health needs for this population. And that includes a lot of cross-sector collaboration, both within our department, with other state departments, as well as at the local level. So some of that work includes things like utilizing our MyBridges community partners to assist with public assistance benefit applications and management of public assistance benefits for this population. We're grateful for those organizations who will provide that assistance and help get applications submitted and also redeterminations, et cetera. Also, as many of you know, with the public health emergency ending, the ongoing enrollment in Medicaid is ending. And so we have to begin as a state to redetermine all of our Medicaid cases. And so we want to ensure that during that redetermination process that our individuals experiencing homelessness don't miss the notifications about the redetermination and ultimately lose their Medicaid coverage. So we're doing some targeted communications with our providers to make sure they're aware of how this is going to roll out, what that will look like, and doing everything that we can to ensure that folks can get that paperwork back to us so that we can redetermine and hopefully keep them enrolled in Medicaid. We know that about 80% of our homeless population is currently on Medicaid. So we know it's been an important program to this population. And so ensuring that they continue that coverage is critical. We've also continued to do identifying trends and patterns in health conditions and healthcare utilization via data matching and targeting interventions based on that finding. The reason I could tell you 80% of our homeless population is on Medicaid is because of the data matching that we've been able to do through the HMIS data that Jerry mentioned earlier and our Medicaid, data set so that we can see exactly how many of our homeless individuals are, enrolled in Medicaid and currently getting coverage and even what their sort of health care utilization looks like, what their diagnoses looks like. What we were able to tell through that data matching is that the homeless population is actually a more expensive and sicker population. We assumed that prior to doing that data match, but it was nice to have the data match, prove that out for us. So we know folks experiencing homelessness tend to have higher rates of emergency room utilization, inpatient stays at hospitals, et cetera. So, using data and doing some of the data matching has really allowed us to do more targeted outreach and to better understand the unique needs of this population and begin to think about more targeted interventions related to that. We've also continued to build on to targeting resources and developing allocations based on population needs and locations, again, using sort of the data that we have. We're continuing to build our SOAR capacity statewide to leverage sustained income for people experiencing homelessness. So SOAR is a sort of expedited application process for people who are homeless and have a disability to actually apply for SSI, SSDI. And so it really helps provide kind of a sustained income for folks. So once they get housed, they do have some additional income coming into them that they can utilize to cover, some of their basic costs of living, things like that. We're also continuing to strengthen partnerships with our physical and behavioral health providers for better care coordination. We know, as I told you, that our homeless population, has significant healthcare issues. They also have, we know, significant behavioral health issues, substance use issues, and so sort of developing stronger partnerships both at the state level and at the local level so that we can have the best care coordination possible across these entities is really critical. We've done that through the creation of some tools like the homeless vulnerability index that we've provided to physical and behavioral health providers to be able to know who of their beneficiaries are currently homeless and how to better provide outreach and supports to those folks. So we've created some tools to make that coordination a little bit easier and excited about that. And then the final thing is just continuing to build partnerships with public health, again, both within our department and with the local health departments to prevent the spread of viral outbreaks. Obviously, during COVID, there was a lot of partnership that happened related to that work. And we've continued to build onto that, knowing that there are other outbreaks coming, and whether it's hepatitis or other kinds of things like that, so that we have the relationships and the systems in place to be able to address those and hopefully prevent them from happening in the first place. So that's the broader work that we're doing here at MDHHS. I should also add, we too are very committed to addressing the racial disparities that exist within our homeless response systems across the state. And so really are looking at the way in which we are delivering programs, the way in which we're funding programs, sort of from a disparities lens, and look forward to those learnings and the changes that we'll need to make once we have that information. So thank you for the opportunity to share with you today the work that we're doing here at MDHHS.
Thank you, Paula. That was great. Fantastic. Now we're going to turn to our next presenter. And it's my pleasure today to introduce Kelly Rose, who's the Chief Housing Solutions Officer at MSHDA, which is our state housing finance agency and state level department. And she's also the chair of the Michigan Interagency Council on Homelessness. Ms. Rose will cover the Michigan Campaign to End Homelessness and its structure today, as well as discussing MSHDA's efforts to increase housing and end homelessness. All yours, Kelly.
Thank you, Lisa. Can we go to the next slide, please? So thanks everybody for joining us today. As Lisa said, I'm Kelly Rose. I'm the Chief Housing Solutions Officer for the Michigan State Housing Development Authority. And I'm going to give you a quick rundown of Michigan Campaign to End Homelessness structure and the Michigan Interagency Council on Homelessness. Next slide, please. So the Michigan Interagency Council on Homelessness, this is its structure. And we have the Michigan Homeless Policy Council within it. And really we work at the state level to coordinate efforts at the local levels within the local continuum of cares, and to really try to coordinate the work at the state level, and to be able to share best practices and to be able to engage directly with our local nonprofit partners to hear what's going on the ground and how we can better work towards serving people experiencing homelessness. Can we go to the next slide, please? So the ICH was created via executive order in 2015. It's made up of members from 7 state departments, 1 representative from the courts, and 4 from the general public. And the broad outlines of the council are to develop a plan to end homelessness in Michigan, to monitor that implementation of the plan, to provide input within the executive and to the legislature, and also to leverage our resources and really to facilitate collaboration amongst all of the partners. Next slide, please. So our Michigan Homeless Policy Council, this is how it's made up. So this group meets monthly, and we have 2 co-chairs that are on staggering terms. And then you can see the variety of state agencies as well as statewide organizations. And we have members of the public as well in this. So really trying to work collaboratively across all sectors that have the influence, the care of people that are experiencing homelessness, and to try to broaden the reach of how we can grow the service agencies as well as the partners involved to be able to better care for people and to get better outcomes in terms of people exiting homelessness faster and making that a one-time event. Next slide, please. So we produce an annual report each year. Jerry was running through some of the numbers from our 2021 annual report at the beginning of this, and really trying to do a deep dive in terms of, what do those numbers look like? What are we learning from the data in terms of evolving our programs so that we're better serving people experiencing homelessness? So this annual report gets published. We also have a 3-year plan to end homelessness. That is another thing that the ICH works to create and to oversee. And then we facilitate, the action amongst these plans in a couple different ways by working with partners and communities all across the state. Many of our members are involved in advocacy for the necessary resources to be able to better serve people, really understanding what the on-the-ground needs are within our communities, and trying to provide training and peer learning through a number of different avenues, and really trying to share those national best practices with all of our service providers across Michigan so that we are effectively caring for people that are experiencing homelessness and efficiently using the dollars. Next slide, please. So within our 3-year plan to end homelessness, we have a variety of strategies and goals across many sectors around the development of affordable housing, which we know is needed greatly across the state. Many renters across the state are paying more than half of their income towards rent each month, and we know that makes them, one car accident or car repair bill or other sort of health expense away from not being able to pay their rent and potentially facing eviction. So we know affordable housing is a great need. We also know that working towards having our systems work better, together and collaboratively across the health systems, homelessness systems, is something that we can see a lot of improvements around, and to be able to really use all the available resources and working on that cross-sector system alignment. And then just really working on how are we sharing those best practices, how are we improving the quality of service delivery across the state. And all of these things are things that we're working on at the state level as well as the local level. Next slide, please. So now I'm going to run through some specific things related to MSHDA and the programs that we have that are specifically geared towards people that are experiencing homelessness and trying to make that a rare, brief, and one-time event. Next slide, please. Go to the next slide, please. Okay, the first one is the Emergency Solutions Grant Program. So this is a HUD-funded program where MSHDA gets approximately about $5 million each year, and we match it with MSHDA funds so that we're granting out approximately about $10 million each year. And ESG is a fairly flexible funding source that can be used in a variety of ways to support homeless households across the state. So it kind of covers the gamut in terms of doing street outreach work and be able to try to get people inside and ready for housing, funds emergency shelter, funds homelessness prevention efforts for people who are facing eviction, and it gets people rehoused. And this ESG is distributed and covers all 83 counties across the state. We distribute it to all of the continuums of care and really work to try to make sure that this can be a flexible funding source to kind of fill in the gaps for some of their direct HUD funds, or as Paula described earlier, funding from DHHS that serves a variety of needs so that they can fill in those gaps with the Emergency Solutions Grant Program. Next slide, please. Our Housing Choice Voucher Program. We have a homeless preference within this program. So it's largely most of the people that are served on the program did previously experience homelessness. And we do have the largest statewide program in the country where we serve over 28,000 households in this program. Our annual budget exceeds about $220 million within this program. And vouchers are not time limited. So essentially people can use their voucher as long as they need to where their income stays within various ranges. And the voucher works to really pay the rest of the rent that the family cannot afford. So the participants pay 30% of their income towards their tenant portion of their rent, and then the Housing Choice Voucher Program picks up the rest of the rent. So that is very affordable to the family. As low as $50 a month is what they're paying towards their housing costs. And we had see great longevity within this program of people serving people for a long period of time. And especially, we have a number of about 20% of our households are persons with disabilities, and it really works towards meeting their housing needs well and meeting their affordability needs. We also use this program to create permanent supportive housing. So I'm going to go to the next slide and I'm going to talk a little bit more about that. So we use our low income housing tax credit program to create permanent supportive housing all across the state. So we have dedicated 25% of our low income housing tax credits towards the creation of permanent supportive housing. And we've been doing this for more than 12 years, having this set aside where a quarter of our credit is specifically designated towards providing greater housing opportunities to our most vulnerable and people at the lowest income levels. We typically have about 6 to 8 new developments that are funded each year. And PSH is really serving those very lowest of income households that have experienced homelessness the longest. Many times they have both physical and behavioral health needs, and really, but for this program, would likely remain unhoused. So we're very pleased to be able to continue to offer this program, to be able to continue to expand the permanent supportive housing access within the state. Next slide, please. So now I'm going to highlight a couple of new programs that were funded with the Housing and Community Development Fund. So these funds were, we had $50 million that was appropriated last year, and some of these funds were used directly for programs that will help people experiencing homelessness. So the Permanent Supportive Housing Gap Financing Program is using $11 million of the Housing and Community Development Fund, and we're also pairing it with some federal funding sources to create a $94 million gap financing program to create permanent supportive housing all across the state. So this program has been released, and we'll be receiving applications later this year. And we're very hopeful to produce thousands of new units across the state for people needing permanent supportive housing, and also for just lower income people in general within the low income housing tax credit program. The next program is a shelter diversion pilot. So we're using $3 million to be able to fund organizations across the state to work with families that are really on the edge of needing to enter emergency shelter, to where their housing instability has really gotten acute, and working with those families on problem solving and equipping the family to figure out what other housing options do they have that are safe, that they can use instead of entering the emergency shelter system. So this doesn't bar people. It is not a barrier to entering emergency shelter if that's ultimately what's needed, but really working to try to work with the family and trying to, use every available resource that they have, and to be able to have case management that can help them see those resources, and also some flexible financial assistance to be able to keep them housed. We're also going to be doing a housing choice voucher mobility pilot. So this works with our families that are on the housing choice voucher program to be able to give them the ability to relocate into areas of higher opportunity. So it's going to work in a number of different ways to make the move very easy, to find new housing in other areas, and to really have a wraparound services for that family to figure out what's needed to help them move into areas of higher opportunity, and to give them more housing choice, really, so that they're able to choose where they're living and to be in an area where they want to be. And next, we're going to be expanding the Key to Homeownership program. So this is a program within our Housing Choice Voucher program that helps families enter homeownership. So largely within our Housing Choice Voucher program, that's a rental assistance program, but we can use the funds to help people purchase homes, and then the voucher funds are used towards paying their mortgage payment. And then they build equity within, by homeownership, and usually within 5 to 10 years are exiting the Housing Choice Voucher program and are just our regular homeowner at that point. So with the funds from the Housing and Community Development Fund, we're able to expand the down payment assistance that we offer with this program to really help make homeownership accessible to those at the very lowest of income levels. Many times people who are on SSDI, really making homeownership available to them, and we're very happy to be able to expand that program. Next slide, please. And now I'm kicking it back over to either Lisa or Eric.
Yes, thank you, Kelly. That was wonderful information and much appreciated. Now I'd like to introduce our last speaker for this session, Eric Huffnagel, Executive Director at Michigan Coalition Against Homelessness, which is a statewide nonprofit and partner in the campaign to end homelessness. Eric will give us some perspective on the coming year ahead and how you can be a partner and get involved in the campaign to end homelessness. Eric, the floor is yours.
Thank you, Lisa, and hello. I'm really pleased to be connecting with you today, and I want to thank you, first of all, for your interest and the energy that you put into the work. With your help, Michigan can lead the way. As a state, we know that we can do more to invest in affordable housing, in homeless services and in programs that open paths to long-term housing stability. We can pursue legislation that will reduce barriers that limit people's access to housing. And we can also do more to address regulatory solutions that can foster the development of affordable housing for everyone. We can also invite and partner with new stakeholders to join us in this work. As we all know, COVID-19 brought to light and amplified disparities and gaps in our housing efforts. But those are things that we can correct. But we need to make sure that we have smart policy and smart budget decisions made now if we're going to end our housing crisis. And it is an urgent matter. This is not a new housing crisis. It's persistent, and it is only getting worse. We need to take action. Devastating rent increases coupled with the steady decrease in attainable housing stock have really had a negative impact on each of us and the communities that we live in. The truth is, we can end homelessness. It's really just a matter of informed policymaking and the political will to make it happen. We need to work collectively to raise awareness about homelessness and to have discussions at the federal, state, and local levels that lead to the pursuit of effective, coordinated solutions that we know exist. Micah wants to be your partner. We welcome your engagement with our Legislative Action Committee, with the Coalition to Expand Housing Access, Advocacy Day, and other efforts that take place throughout the year. So please reach out to us to learn more about how we can work together so that we can bring smart, data-driven solutions to Michigan to prevent and end homelessness. And you can see Lisa's contact information there on the slide. I'd also like to thank our panelists today for doing a great job of sharing information to help you all have a better understanding of homelessness within Michigan. And again, thank you for getting involved.